Welcome everybody to join me at this session about the Dutch approach towards sustainable framework for personal health environments. I'm alone. Vincent van Pelt is a colleague of mine. He may be joined later, but we'll see. Why isn't it? Yep, it's moving. I'll have 10 minutes, so I'll go a little bit fast maybe, but if there are any questions, please ask them later, no problem. In Holland, there's still increasing evidence that well-informed and decision-making individuals contribute to meaningful care and experience a better quality of life. So in Holland, we see this as the opportunity to start a new kind of health exchange information between the individuals and care providers. So it used to be a little bit more like a one-way street, and now we see that there's more a network starting to develop between those individuals and the care providers. And that's why MedMij has started. MedMij makes it possible, it's a program, MedMij, it makes it possible to combine the health data safely and reliable in your own personal health environment. And it's sort of a new mobile-based dossier for people to access their health data from different kind of care providers. So it's the definition in Holland of the PHE? Well, it's a personal health environment. It's a lifelong tool to collect, manage, and share the health data in one place, so that you can take more control over your own health. It should provide a new kind of interaction with the health providers. Why is this important? Well, insight is important. That's what people say. Taking control and integrate your information in one place. It's now scattered around different sources, and they say it should be in one source. A lot of people in Holland just want to see one place where they know where everything is found about their health. And they're also helping the caregivers getting access to that information quicker. That's the idea about MedMij. So it's not only a place where it's collected, it is also a place where you can distribute from. So now it's more like an individual one-to-one situation, and it needs to go to a more kind of network. And that's what MedMij wants to achieve in Holland. The core tasks of MedMij, those are to facilitate those digital exchange of the health data between the residents of the Netherlands and the healthcare providers. But it's also creating confidence that is done in a safe and sustainable and affordable and user-friendly way. Especially affordable and user-friendly is our main goals, because you have all these e-health apps and people need to pay for them. And so we want to make them affordable with low costs, and it needs to be more user-friendly. Not everybody can use a mobile device, elderly people, people with a language difficulty. So we want to do it as friendly as possible in Holland. But there are portals with information connected to individual caretakers. So we're now also developing the PHE to be a little bit better than the portals. The access of one is need to be the access to several caretakers. Again, when it's connected to one care provider, there's not really a freedom of choice. With the PHE, the intent is that you can access different care providers, so you don't have only one portal. There's some other benefits on the slide. The slides will, of course, be available for everybody. How will this work? Now, MedMij will be working in a framework, and I will explain a little bit what you see here. You see that at the base of it are a set of agreements with participants in this framework. And you see two types of participants, the PHE side of it on the right, and I will show the left, where the caretakers are. The caretakers themselves aren't connected into the framework. They are helped by a service provider that will make the connection with the source of their own systems, their own interface for their own place where they're put in their information. So they have a service provider that will make that connection. In Holland, we decided to take FHIR as the connection between the person and the service provider for the care provider, because this is a much more efficient language to use in the mobile world, and it's an international standard that is going very fast, so we can learn a lot with more people than just our own solution. I will go through these quite quickly. Oh, excuse me, this was a little bit too quick. What does the framework do? It states which parties fulfill the roles of the data exchange. There are agreements between these parties about the rights, the obligations, the incentive, the sanctions, of course, because it needs to be a safe place for the exchange. If it goes wrong, there are sanctions. But of course, before sanctions and everything, we also do certifications and testing. So we are very confident that the information comes that it will be okay when the information goes through. I will go a little bit faster because of the time. The priorities are, of course, that there is a right to the data access. That's also in the law now in Holland. So care providers, if a person asks for their data, they need to share it. A PHE is the best way, we think, at MedMij. You also need consent, and it's citizens have to agree to share the information. If one PHE doesn't work, you should make a free choice to go to another one with the same access to the data. It needs to be convenient and, of course, safe and reliable. Is very important. But it's not the only participant in this for MedMij. Also, the caregiver, care provider are very important, and they need to be assured that what will happen with the day-to-day register is also not going anywhere but the patient, the citizen of Holland. So the file he makes, the dossier he is responsible for is still his file. A PHE isn't also a medical file. It's a view into the file. So it has no status as a medical file. There are no access to interval notes, so private messages to other caregivers are secured, that people won't see them. And of course, law and regulations are also taken care of. Again, one of the things that is very important in this is that we think that the dialogue in the consultation room will change when people have access to the same information. Things will go faster is the idea, and healthcare will be less expensive. The financing system for this all, it's funded by the government in Holland. And there are two ways the funding goes. It's for the individual side of it, which is for the PHEs. It's a sort of stimulus, and then continuous stimulus and a sort of structural finance, but also at the care side, because it's a movement to change the healthcare system in Holland. And the care providers have another, their dynamics and their change rate is sometimes different between those domains. So there is a funding for all those domains, which is more close to how quick they can change. All in a whole, over 500 million euros is put into this system to make it work. We work with a lot of standards in Holland to provide the information, and we're very proud to show this, because on the patient side on the right, that's the person who wants to see into all the information, and the PHE is already can access all these dossiers you see here in Holland. So we're very quick at a total view for the patient by using the PHE. Because of the time, I will skip a couple of sheets right now, because this is going more into the development of standards, and maybe that's less interesting for now. This one I will show. We work in Holland with generic building blocks when using the standards, and that's because those blocks can be used in different standards. And that's how we try to provide, to give a data model for the new healthcare system. So cross domains, you can change the same kind of information that's based on these blocks. So people know what they send and what they can expect when somebody sends them their information. This one I will skip also. Again, the standards, we're so proud of it that this is already available for patients right now to look into. You see here the push and the pull. We have two kinds of ways the information can be collected, the pull kind of thing. And we have about 10 to 15 use cases that can pull information, and we have now 4 use cases that can push information towards the caregiver. So that's it. That's the one that will change the interaction also with the with the caregiver and the patient. Now, what's the current status of MedMij? There are about 48 prospective participants. Those are 25 PHE developers, suppliers, and the rest are suppliers that connect the caregiver systems to MedMij. We have an agreement system 1.3 published. One of the things that's now in there is subscribe and notify. So that's a very nice feature that you don't have to synchronize all the time your dossier in your PHE, but you get notifications that something has changed. We are developing new standards, data standards. Vaccination in this day and age is a very important one. We don't have that. That will be developed in 2021. There's new finance on the way, so it's more to sustain, to make the system more sustainable. We are very active in implementation of the agreement system and the standards. So, and we're still monitoring the go live. Well, all this is developed to make a basic structure, and we hope that the plant will grow, and the new health kind of way, the new health system will flourish as a plant. There are, of course, challenges. I will go through this. Oh, that was a little bit quick. Yeah, the dream touches the practice. We see now that some things may not work in real life. Maybe a standard that isn't very aged yet to work. The user-friendly personal health environment is a challenge because of so many dossiers. You have so many different languages in the health system. People don't understand all the data. The change in the healthcare is, of course, a slow one. Caregivers, yeah, they need to change their state of mind, their processes to work with this concept. And of course, Corona didn't help. It takes us about a year extra to where we wanted to be. The year 2021, what will help it? Supporting live initiatives, monitoring the go live, see where it goes right, see where it's go wrong, learning, stimulus of the PHE use, a national campaign, what is it, how can you use it? And we, of course, continue develop products for the MedMij system. And that's it. So if there are any questions, please ask.